Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. The next one is abducent nerve and applied anatomy. In a lesion of the abducent nerve, the patient cannot turn the eyes laterally. When the patient is looking ahead, the lateral rectus is paralyzed and the unopposed medial rectus pulls the eyeball medially, causing internal strabismus. Next, facial nerve and the applied anatomy. The facial nerve may be injured or become dysfunctional anywhere along its course from the brainstem to the face. The paralysis may be supranuclear or infranuclear. Supranuclear facial paralysis involving upper motor neurons pathway is usually a part of hemiplegia. It involves paralysis of the lower part of the face but not the upper. The infranuclear lesions vary in its effects depending on the site of lesion. Due to the anatomical location of the facial nerve, neighboring structures are inevitably involved. If the facial nucleus or facial pontine fibers are involved, there may be damage to the abducent nucleus, that is paralysis of lateral rectus. Motor trigeminal nucleus may be involved, that is paralysis of the masticatory muscles. Principal sensory nucleus and spinal trigeminal nucleus may also be involved, that is sensory loss of the face. Bels Palsy. It is caused due to the inflammation of facial nerve near the stylomastoid foramen or compression of its fibers near the facial canal or stylomastoid foramen. The next one is vestibular nerve. Disturbance of the vestibular nerve function include giddiness, that is vertigo, and nystagmus. Vestibular nystagmus is an uncontrollable rhythmic oscillation of the eyes. This form of nystagmus is essentially a disturbance in the reflex control of the extraocular muscles, which is one of the functions of semicircular canals. The causes of the vertigo include diseases of labyrinth, lesions of the vestibular nerve and cerebellum, multiple sclerosis, tumors and vascular lesions of the brainstem. Applied anatomy of cochlear nerve. Disturbance of the cochlear nerve function produces deafness and tinnitus. If you have any doubt, please comment. We will clarify surely. Thank you. Have a nice day.